What about, very important you mentioned it, because people get married. Sometimes they will ask, should I marry somebody that is not with the same blood group with me? Yes. You can get married with somebody with different blood group.
Yes.
And you can also marry anybody because of the blood group you can marry. But the one that causes problem, which also not just only the solution is also available. So you can marry anybody, not in the aspect of the sickle cell. It's a different ballgame, which is not the subject for today. So looking at that very one, you can have what is called rhesus incompatibility crisis. How does it happen? If a woman is negative, there's what is called rhesus factor. There's a positive, negative. That is the area that one is of a concern. If a woman is O negative or A negative or any blood group negative, that negative in it, yes, if you now marry somebody that is whatever positive, all right, what happens is that when the baby goes into stayed in the womb, because the baby stays in a different environment. That's why you can have different blood group, different this one from the mother. So it stays in that very place. If that baby is positive, the blood of the woman, or the what they call IgG, immunoglobulins of that particular woman, we identify that very baby. That look, this very baby,
don't know this positive thing.
I don't know. It do resemble us. They understand me? The one of IgA, IgG, IgM, those ones can't pass through the placenta. Only the IgG is this small.
Okay.
So it can go inside, only to discover that the people here
are not like me.
Are not like us. It will come back. When they come back, it will tell other people, the person who I see here today, I don't understand who that person be.
The head big, be like us.
So, what the body of the woman will do now,
yes,
is to start generating antibody against that thing they saw. Then, but before they will generate enough to find that very baby there, the baby has already grown. Yes, I mean, get to the time. So they deliver the first baby without problem. Do you understand? So now, by the time
that antigens is still
still now building up. So before the next pregnancy, they've already molded enough antigen, both suicide bombers and all the rest, and waiting for the whosoever that will carry such thing to enter inside the body. Do you understand? So if unfortunately the second one comes in bearing positive again, so what will happen is that they already build enough ammunition. They will go there and they fight that very baby that is inside that very womb. So sometimes that baby may not be able to grow well. Sometimes that very baby may even die. That's what is called erythroblastosis fetalis. So it's associated with that. So that very baby will just go. And that will happen in all the other...
as long as they all come positive.
Yes, as long as they come, we will not allow the baby to stay. And that comes to the issue of when should a woman get sensitized. A woman can get sensitized by having abortion, and after the abortion, he didn't take the Rogan. So a woman can get sensitized after miscarriage, and just by reason of miscarriage, he didn't take. He may also get the woman sensitization.
That means the ammunition is building up now.
Yes, so the woman will now get married. He discovered that I've been pregnant before. What is happening to me? It may be from the previous sensitization of that very body system against whatever resemble that kind of a thing. Do you understand? So that's why it is important. If you get married, you are O positive or O negative, for instance. As a woman, you don't need to panic. Whenever you get pregnant, all right, within 72 hours after delivery, you should take what is called Rogan. That Rogan, immunoglobulin D, it suppresses the body system,
those antigens that have been built,
developing those soldiers. So it makes it that every pregnancy you take it, every pregnancy you take it, will not allow him to develop something, because they need to be many to be able to do that kind of
havoc on the baby.
Yes, on the baby.
All right, but this can only happen to women who are negative, right?
Yes.
So a positive woman who gets married to a negative man has no problem.
Yeah, the same thing could happen if the other ones also happen to be negative. The body system will also
wonder what is
whatever the issue, they both need to be closely followed,
monitored. Okay, all right. So we've got that sorted out. So this is something that a lot of women didn't know about. That like for a long period, I used to wonder, why do you have positive on top of your? Just put 0. What's positive and negative about it? It's good to realize that. Thank you, doctor. So you also did mention the fact that for women who are diabetic, well, somebody did ask something here, and I think it's important I ask that. With the case of multiple fibroids and a pregnancy, if the fibroids are not inside the womb, is it possible that you can achieve pregnancy till the last?
Yeah, let me just make it practically clear here. That a woman has fibroid does not mean that woman should not be able to achieve pregnancy. But it's all dependent on the location of that very fibroid, and also the size vis-a-vis the that of the fallopian tube. So it is important to establish that. But when this woman get pregnant, depending on how they will react with this, and it causes miscarriage mostly. Not that it may not be able to achieve, except if the fibroid had distorted the architecture of the womb. But it's prone to miscarriage, one. And second one also is that the fibroid in the womb, as the body starts expanding, food may not be enough for everybody, and they will now start suffering what is called red.
Why is the fibroid eating the food too?
Everybody in the womb. The womb is a very generous person. He doesn't consider that this one am I made. Some people will have, if you see their children well fed, why the maid will be only with the head and the thick body. No. Everybody in the womb is generous. In your house, feed everybody, I beg. Okay.
So the womb is just like that?
Yeah, the womb is just like that. Feed everybody inside your house. So when by reason of the fibroid maybe not getting enough, it may undergo some changes. They call it red degeneration of fibroid in pregnancy. So the woman will be having intermittent pain, very severe pains occasionally in pregnancy. So, but that can be shut down, over the issue of giving it the injection and all that, and that very pregnancy will be over. But it's
possible. Okay. All right. So now we get to the point where a diabetic mom is about to have a baby. And you mentioned the fact that with diabetic mothers, the possibility of having babies who are overweight. What would be the standard weight of a child here now? Of a baby?
Yeah, the word standard is relative, but when it's more than 4, you call it macrosomia, that this baby is quite big, all right? But what I want to point out in diabetic, as earlier said, if you are diabetic, you're supposed to at least plan pregnancy within 3 months. And the gold standard says that this woman, in order to avoid that complication of neural tube defect, which is associated with that abnormalities associated with the diabetes, it is important they start taking high dose of folic acid at least 3 months before
delivery.
Before
getting pregnant. Okay.
Yes, that is a precautionary measure. And then in diabetes, what happens is that this woman suddenly have excess sugar in the blood, and of course somebody that is food in house, you should expect the baby to become puff. All right, so the baby will now start getting big. But very critical thing I want to state here is that because this very baby is getting big, the placenta supplies within 34, 35, 30, up to 38 weeks. If the baby size sometimes may be more demanding than what is coming in from inside. So they may suffer what is called placenta insufficiency. All right. And additionally, this baby getting that very big, if he's not getting that enough, he can suddenly, he touched the baby, the heartbeat will just disappear. He said, I've just checked now, but all of a sudden this morning I didn't get the unexplainable sudden demise of the baby. So that's why most times they allow, if this baby has reached up to 38 weeks, let the baby come out
at
for
that
safety
period.
case of everybody. Then if you gestational diabetes, most times when you deliver the baby, gestation, I mean that the diabetes started when the pregnancy is
occurred.
Most time if you deliver the baby, the sugar level
Would drop.
But coming to what also happened, apart from the fact that may pose a problem in delivery, whereby because of the size of the baby and all that, you may have what we call cephalopelvic disproportion, which we will come to that on the issue of cesarean section. So when such happens, what will happen is that when this very baby that is used to overwhelming sugar inside the womb, and to manage that excess sugar, that very baby will develop, the pancreas will be working more to produce insulin that will also control the sugar for the baby. Now, because of that high level of insulin inside the baby's body, if you deliver that baby and leave the baby, the insulin will wipe off every sugar inside the blood, and that immediately after delivery, you see the baby looking good, only to you to come. The baby will die of hypoglycemia in express dimension. That's why when such a baby is delivered, with or without the mother's breast coming out, there should be a pediatric management of that very baby to top up the sugar. Pending the time the mom started feeding and the body system start realizing, the food no dey the way, they come the way they come before. So the body system the pancreas will start adjusting to the normal life of that very baby. Otherwise, that is why they deliver the baby and all of a sudden the baby goes is an attack.
And this happens within a very short period.
Immediately after delivery, because the baby is still in the pool of the insulin that is used to as it was in the body. So that's why even a diabetic mother should not deliver in some of these, I'm not saying maternity, but I'm saying even in maternity, make sure you have a link with the hospital where this
kind of care can be given.
This thing has become so critical. You see the way people are just delivering and dying, losing their baby as though God. And the most painful thing is that you hear them saying it was an attack, How long can we continue to wear Satan this very crown? We are having a program on the 20th and the 21st, 20th and
July?
the 25th of this July to talk about all these subject that has to do with delivery, what do you have to do, and all those kind of stuff, because there's so many in this thing that there's no way we can exhaust in this area. So on the 21st and on the 20th and 21st of this Tuesday and Wednesday of this ceremony, we're going to have it's going to be a conference for pregnant women and those preparing for pregnancy. Getting to know this, you're not only saving yourself, you are saving your loved ones. So many crazy things happening in our society. We can't allow to continue to happen.
All right then. Okay. So conference. You said which women can come? Let me know.
Every woman can be. Every woman just
but you can't exclude the men now, because I mean they're married to their wives. They need that knowledge too.
Men can come with their wives, no problem.
All right. Okay, so we just spoke about the diabetic mother, and you said it's best advised that they have their babies delivered at the 38th week because of...
That is also under the discretion
of the doctor.
Do you understand me? So
every diabetic mother has different...
Yeah, it should be followed up. That's what I mean. The essence of this discussion is not to establish that every diabetic woman will go for cesarean section. No, it is also in the discretion of your doctor. Yes, of the obstetrician to be able to look at that.
Okay. So what about the mom who is hypertensive?
Yeah, hypertension in pregnancy is a very critical one, as well as you can see. That's why it's also part of the pregnancy counseling, because it has been found that there's what is called hypertension in pregnancy, and it's in three forms. One is what they call hypertension pregnancy induced, otherwise called preeclampsia, which usually a woman who has never been hypertensive suddenly discovered that after 20 weeks upwards, the BP starts going up, and also associated with protein in the urine. That's why it is important, this hospital thing we are talking about, that this person, you do a test that should be able to say, is there any issue, is there any urine? You know, so that can happen, and we'll give you information about what to do about that one. Then the person is already a chronic diabetic hypertensive before getting pregnant. You understand? So such person is also, so when it has to do with hypertension in pregnancy, it's a multidisciplinary approach in management. The physician has to come in there, the dietitian has to come in, the obstetrician, or a lot of, it's a this thing that should be can happen. But the one that is most critical, which kill most of this, cause most of the premature delivery, death of the or even the death of the mother, or causing the mother to convulse, is what is called preeclampsia. All right. This preeclampsia is something very important, because women should get to know. I think when it has to do with delivery, women should take responsibility of their health and their life. Because there's a scenario, one woman was in a critical state, and only for the husband, because of he had hypertension in pregnancy, the husband was insisting that she should carry on.
Yeah.
And only for her to insist, deliver this baby, otherwise she would have died, because the man does not know what
she was going through.
Yes, that's why I say to women, when it has to do with pregnancy, my dear, it's you and your baby. If the woman dies, even in the burial, the man may be having an erection towards another. So it's not something that he will be in position to say, hey, later in that state, yep. If there be a situation of preeclampsia, it's your doctor and you that should take that very decision very critically. And for the men hearing me now, they should be able to assist when a time like this comes. Now, in the aspect of, let's say, preventing it, there's what is called NICE guidelines, an evidence guideline based in England. It is actually designed that you can classify some women before they get pregnant into high risk, and you also classify them to moderate risk. Okay. That those one of high risk is this woman having any problem with a renal problem, kidney related problem? Okay. Is this woman a chronic hypertensive? Is this woman have a previous history of this preeclampsia we are talking about? Or is this particular woman have something that called autoimmune disease, or this lupus, systemic lupus erythematosus, that's SLE? All those ones are classified that if this woman has this, is a high risk patient in that very, even before the pregnancy. Then you also group the one they call moderate risk. Is this woman obese? Is this one having a family history of preeclampsia? Is this woman what is called age related, where is it under age, like less than 20 years, or is it more than 35 years? Or is this woman getting pregnant for the first time, we call it primary gravidia, or having multiple pregnancy? Is the interval between this pregnancy and the previous one so long, like in the case of having up to 10 years? Wow. Of this one came before the next one. So any woman that fall under this category, he put it at moderate risk. So the NICE guideline says that if this woman has a major risk, one major risk, or two moderate risk, that woman should be placed on vasopressin. So we have 75 milligrams in the United States, you have up to 150, but that should be until pregnancy, until delivery. Yes, that could be in position to avoid the recurrence of the, so that's one key thing about hypertension in pregnancy. So if the woman now have preeclampsia, as well, it has to be managed. But that woman's life should be more important than any other factor. Otherwise, the woman can fit and the woman can die. You get what I mean? So that's at that point, it's hospital management exclusively. It's not the one they say, they give me drugs. No. Hey, this person need to be in the hospital and be given maximum attention.
Okay, so in the case of a diabetic mom, a hypertensive mom, at the point of delivery itself, is it that there's extra stress on the heart that could cause these major issues that we've talked during the giving birth itself? For the hypertensive mom.
Yeah, the issue is
there more stress on the heart during that period? Yeah,
let me put it that the heart aspect of it is one aspect, but the preeclampsia is associated with blood dyscrasia. What I mean, the blood factors, the clotting factor may have a problem. So there could also be another problem in the terms of delivery. That is more on the extreme analysis when we are talking about bleeding during
delivery. Okay, so we've gone through a diabetic mother and a hypertensive mother. Now, during this last 3 trimesters, is it possible that for a woman who wants to give birth and hasn't done, maybe was unable to get any of these tests done, is it possible that during the last trimester it can be done? I know a lot of women who didn't do any of these tests, didn't register. Like you mentioned, someone have been at traditional birth attendants before, and then maybe at the last 3 months decide, oh, let me just go to a hospital. Is it possible that at these 3 months other things can be detected?
Yeah, but you can do all those scans, to check out if there's any abnormality in the baby. But what should be very critical here now to mention is the issue of anemia. Anemia is when there is a low blood level. And what
for the baby or for the mother?
On the mother now.
Okay.
They're talking about the mother now. So when there is anemia of the mother, anemia in pregnancy, the World Health Organization defined it that when the hemoglobin level is low, or the level is lower than 33%, or 10 gram per DL, just 11 gram per DL, for people out on a global scale. But for those in this side of the world where there is malaria endemicity, the World Health reduces it to 30% PCV or 10 gram per GL. So when a woman's level goes down
below this,
yes, there's a concern, because anemia in pregnancy will affect, number one, it will make that very baby to have small size baby, which will also I hope time will be.
There's so much that we have for there. Okay.
The size of the baby will be small in size. It could cause what is called intrauterine fetal death. The baby may, because it's not receiving enough, the baby may go. It may also cause the issue of during delivery, because it's the blood that brings all the materials for to stop bleeding.
Okay.
Do you understand? So this woman will have postpartum hemorrhage. That's the blood will not be able to clot, and that become another critical problem, and because also it brings the material for healing, there will be a poor wound. Healing of that very wound will be a problem, just like as if the person is immunocompromised.
Yes.
All right. So anemia in pregnancy could result from malaria. You see, malaria is the most critical concern anybody should have when pregnant. And do you know one thing about this malaria thing is that the mother may not feel the symptom first while the baby is already suffering. And that's why it's advised that a woman should not wait to feel that I'm feeling the symptom before attending to it. That's why they did what is called intermittent prophylactic therapy for malaria. Like, a woman should be in position to take Fancida or the brand of all those
Along
paracetamol. So those group of drugs in the group of Fancida should be taken once the woman feels the kick, like a multi-pregnant, somebody who has been delivered before. It used to be about 16 weeks, but somebody who has not delivered for the first time, that first kick of the baby may be around 18 weeks. So once that is established, they should take this Fancida every month. Every month. In fact, it's a direct observation therapy that you should see the patient, the mother, stay before you
and ingest the medication.
Yes. So every month until delivery. Before this time it was just saying until 36 weeks, on the basis of what they call hyperbilirubinemia. Because of this type of it, but it has, the World Health Organization, the research has shown that doesn't happen. So you take it till the end. And also the aspect that has to do with malaria in pregnancy is that you should be able to continue that. If the woman reacts to sulfur, there are people that react to sulfur. Those ones will now go on proguanil, that will be like a continuous therapy every day. So, but it is important you prevent anemia in pregnancy and malaria in pregnancy. Do you understand?
Yeah.
So other things that can cause anemia in pregnancy, apart from all those UTI, hookworms and all that, you also look at the issue that has to do with bleeding. If because of all those antipathic hemorrhages and all the rest, so which we can, if we have any.
Let's not push anything to if we can, because obviously we won't be able to reach a lot of things. But I'm glad that we're able to go through the entire period, the 3 trimesters, and find the different possible.
There's also one other thing else, issue of tetanus toxoid.
What's that?
Tetanus toxoid is important. This is a vaccine to enable them not to have any problem in terms of all those infections. These are some of the things that kill most of the baby if they get infected with it. Also the mom can cause them to convulse. Tetanus toxoid is a vaccine, and it's usually taken, just like I said, this in front. That very the first one does not confide any immunity at all.
Okay.
But you take another one 4 weeks later. All right, that one can give you up to 1 to 3 years coverage. All right, then you take another one 6
months later.
You give it 3 to 5 this. Then you take another one 1 year later. It gives you up to 10 years, and you take another 1 year later. It will cover you throughout your reproductive career. That to say,
reproductive career
is it has to say that it does not necessarily mean that immediately you deliver, you will not take again. You can still maintain the taking of it to enable you have no issue throughout.
So what you say this helps prevent?
Tetanus infection.
Tetanus infection.
Yes.
Okay, all right, okay. So let's get to the other issues here. We did mention that we'll speak about intelligent parents who delivered kids who are not so smart. I want us to touch that because we have to open the phone lines in just a moment. So it's important we jump a few things and get to that part. So we have seen cases where parents are surprised that they went through normal birth processes, perhaps did a couple of these tests that you did and everything was okay, but they find that they're struggling with their child who is not catching up in learning processes like every other child the same age as this baby. Are there things that they didn't do, overlooked, or are doing that is causing this?
Very, very key, because it's a concern any parent should be able to have. Why my children not performing, apart from the one we come from God, which you will not be in position to query. We're looking at the aspect that has to do with the delivery of this baby. What happened at the point of delivery? Number one, as earlier said, that a baby that suffers severe anemia during pregnancy will definitely have some level of compromised development.
So that means when the mom is suffering from anemia, the baby too is suffering from anemia.
The baby will not have enough
blood
enough
supplied
to be able to develop nicely. So that's one of the key things that any woman with pregnancy must avoid the situation of, they say your blood level is low. If it gets too low, though you can have what is called hemodilution in pregnant because of excess water inside, but that should be overruled because of to establish that you have it. Then we look at the other aspect that has to do with the point of delivery. See, a baby supposed to come out with a, it is that very cry of the baby that actually pushes oxygen to the brain, and the brain development and all those things, continue. As a matter of fact, the brain does not have complete up to the first 18 months of life is when the brain fully develops. So there should be nothing that should compromise the state of that very baby on the aspect of coming out. You see some of the babies that are all this cerebral palsy.
Yes.
You begin to wonder
how
some of them. That's why I pray for everyone to understand. This one is saying you will deliver like a Hebrew woman. It is something we have established here. It's not ignorance acquired. It does not exist. We have established it here last time. Makes many people stay there in 3 hours is already risking the life of that very baby and the intellectual quotient of that very baby in future.
So all those who said I labored for 3 days,
it's unto God I commit their soul. So on that particular call,
yes,
this labor going that very much, and this woman will be there. Sometimes the baby will even come get trapped, and because of what is called cephalopelvic disproportion in most cases, whereby if the birth canal of this very woman, that's why during that very training program we're going to have a discussion. You see different types of
birth canals.
The birth canals or different women. All right, gynecologic is the best for all women, but not all
have that.
Yes, some even have that of the one that looks like a man, android baby, but it doesn't make them abnormal. No, they can still have their babies, but be the best route that should be able to be favorable to them, and because this time the baby will just stay there. At the point of delivering that very baby, the baby sometimes may come out flat, and they have to now start slapping the baby back. See, the baby committed offense coming into the world. It's not really necessary. If you do a nice rubbing at the back of a baby, the baby should be able to
open its mouth and
you and tell you that I'm here, please don't beat me again, I don't have any problem. But by the time they start slapping, that baby will come out with annoyance. He come out with annoyance. Now they started, that's why you see some baby that are very stubborn, because
they slap them into
he's already used, so you train him to be
you slap them into stubbornness.
So, but when they come out and suffer what is called asphyxia is that this baby is not able to initiate and maintain spontaneous breathing, whereby if you come up, the baby will just lie flat. The doctor will do it will come up again and again and just struggle, and eventually that baby may pull through. It may pull through, or if not end up with cerebral palsy, it may end up with one compromise or here or there in the brain. And once that happens, that is the baby you will say 2 plus 2. You will say is 22, and they will not have any remorse
about it. So wait, the cry in itself is what push. Are you saying at that point they're not breathing?
Yeah, as a matter, when it comes out, it's that cry that gives them that very force
for the lungs
to open, flush water that is in the lungs, and also give oxygen to the brain. So the lungs now will become an airbag. Otherwise, it's initially filled up with
liquid.
Yes. So the issue that has to do with delivery should be very spontaneous. it should be spontaneous. If a situation the doctor is telling you that your baby heartbeat is no longer doing well, or that your baby need to go for CS, most of the time he said the doctor just want to do cesarean section. I don't know the kind of poverty that could be described. I'm not here to defend the opinion of a doctor, but I want to tell you that your doctor knows more than you know.
That's why he's the doctor.
Yes, he knows more than you know. So, but you should be in position to interact with him. And I've already said it here. If police can say that police is your friend,
then the doctor is your best friend.
I tell you.
The doctor is your best friend.
It's your best friend, you can imagine. So on that I go, but all what you need is a relationship, you know. It's relationship in the sense that you are talking to your doctor. Hey, just please, I don't have understanding of this. Can you explain it better for me? Do you understand what I mean? But some people out of arrogance, just, you know, if you get to United States, you see some crazy things happening. And happen more among blacks who we claim they know, but they don't. But if you have an issue with your doctor, nicely ask him, please, can you just put in this? But some people will say, it's my right to know. It's not your right to know. Your right is to go to medical school, graduate, become a doctor, and then be able to have the right to be. But to get from someone, you must have to be polite enough to be able to say, please, can you put me through? And I don't see any medical doctor you will approach in that level and we say, no, I don't want you to know why this and this is happening.
All right. Okay, so this is a course of unintelligent babies. Is there anything at that point, after maybe, is there anything you can do? Maybe you've had this baby now and they were unable to take in their first breaths as quickly as possible. Is there anything you can do after that to salvage any possible damage?
Of course, that's why the pediatricians are there. You know, that's why I keep on saying, in any hospital you are putting a register, ensure that it's
a pediatrician?
Yes, a pediatrician backup. There should be the gynae backup. You have to look out for us, even anesthetists, because there's always this golden hour
opportunity
God usually provide in every death situation. So that very golden hour, maybe there's an emergency right now. If the anesthetist is not there, you can wait and wait and wait and wait and wait and wait and wait before you know it. They say the heartbeat of the baby is gone. The end is going to be thing. So that's why it is important to be in position to register with the hospital. Some people say, no, I don't want to be in position to register with a private hospital on the basis of maybe private hospital is expensive and all that. What is the teaching hospitals there for? If you get to teaching hospital, you see all the doctors also available. So it is not something anybody could be in position to say, why I take my wife to go and deliver in just so place for which the woman dies or the baby dies. You know the painful aspect of it. Those that will say I will deliver like a Hebrew woman and they lose their baby, they will not come to the altar to share testimony. It will hinge it on the devil or the demon that after them. Do you understand what I mean?
Not their stupid
Yes,
decision.
those other ones will now, those that died are in the grave, silent forever. You know, so we can't allow this to continue, and that's why we are carrying on this very campaign on moving Nigerian life expectancy from what it is now to 70 years by 2025. And to achieve that, majority of the death happen on under 5.
Maternal and infant.
Do you understand me? So it happened on under 5. So if we're able to achieve a steady decrease in the number of maternal and infant mortality, Nigerian life expectancy will also
continue increase. All right, then just one more before we open the phone lines. The part where you spoke earlier, when you said the woman could experience excessive bleeding during birth. I remember a story I heard once where the placenta wouldn't drop. And they did everything they couldn't, and I think they said they were fighting against time. But bottom line was that the lady died eventually. So I mean, what are the complications that could lead to that when the placenta doesn't drop, and then also to the fact where you have excessive bleeding and you can't seem to stop it? Because I've heard a lot of women who died
Yeah,
from excessive bleeding.
That is it's the commonest cause of death in our environment. It's the commonest cause, followed by postpartum infections. Sepsis, you know. So the issue is bleeding is the womb is a blood bag, as it were, because the baby is there, everybody is supplying whatever. All right, then you take the baby out under normal circumstances, and their very womb should be able to contract. All right, that it should start contracting. That's why doctors sometimes, if the womb is, they will be touching the
stomach.
Trying to chunk the stomach to be able, the tummy, the womb, to be able to see if it can react and start contracting. But as earlier said, in the state of anemia, most of those materials that are supposed to cause that may not come, and such a situation, the womb will not remain flappy like that. It's not moving, so it will keep on pouring the blood. You keep on pumping. You try to put anything, nothing. So at the end of the day, you see that very woman, if there's no blood available, the woman can die, or the issue that has to do with other intervention that may happen. So on that is what is called, when it has to do what is called postpartum hemorrhage, bleeding after delivery. It comes in 4 different T's. You have the one we have just talked about, which has to do with the tone, that the tone of the muscle is no longer what it is, because it's called uterine atony. And then you have the one of trauma in the sense that if there is a rupture of the womb, like some people that will say, I must deliver like a Hebrew woman, and the baby can't come out, over the time of staying in the labor, the womb will tear, boom, blood will scatter everywhere. That is the commonest cause of women losing their womb during delivery, and at the end of the day, it becomes a family crisis. We also could have the issue that had to do with thrombin, where there is the material responsible for clotting of blood will not be there. And when that does not happen, it means that nobody to stop it.
Can't you inject thrombin?
No, you can have a concentrate, but all those things, this is an emergency situation. So a lot of things can still be put in to see how best can manage it. Or if you have what is called a DIC, one can just bleed, and the woman can just go from there. And another one also that goes to do with this issue of tissue. That's the 4 T's now mentioned. The issue of the tissue has to do with the placenta. Placenta, under normal circumstances, when you deliver the baby and that 3rd stage you pull out the placenta, it should follow you. But in some cases it may not follow. And you have an attachment to the wall of the womb. That's the one that doctors, if it is mild, the doctor may put his hand right inside the womb to begin to remove it manually, gently from the back, and see if he can pull it out. This can only be done by a doctor. So you find out the reason why in the situation.
Could you put his entire hand in there and pull out?
It's just if the baby can come out there, it's in the hand.
No, but hasn't the cervix closed after the baby?
No, baby. When the baby comes out,
the cervix is still
same manipulation.
Manipulation.
So, on that particular accord, when you cannot have what is called placenta increta. Placenta increta, let me just use beautiful pictures so that people also hearing me can understand it better. If you have been to the farm, that's why it's good to live your life from the village.
Go to the farm sometimes.
If you are harvesting a yam, there are some yam that have very smooth body. If you are digging them out, after a while, just hold it, you pull it gently, it will come out with the sand. All right? That is the way placenta ought to be. But some tubers of yam tend to have thorns on their body, and have a strong grip on the soil. So by the time you are digging it, if you don't dig it to the last bottom, any attempt for you to pull it, it must cut. If you have lived in village, you would have seen the beautiful picture of what I'm telling you. Hey, it's good to start
village. You have damaged yams.
So if you're not careful, you have a lot of yam that just get caught.
Yeah.
So that very thumbs is what that placenta develop into the muscle of the womb. So it now get gripped there. So as the effort to make it to come out, it will stay there. Some can grow what is called pancreata. It don't pass the womb. Even the surrounding organs around, you go there and attach. You know, I don't know what one looks satanic.
What a placenta!
I don't know where.
Where are you going to?
So if such happens, that woman will bleed and bleed, except that womb is removed.
The entire womb.
The entire womb is removed. That woman will bleed to death. So that is the point. Dr. Wenan said, please, sir, we need to take an action here.
Can these things be seen during scans that, okay, your placenta has extended?
Yeah, the issue is that the placenta, you can know the location of the placenta. You understand me? If it is like what is called placenta previa, that the placenta is located, if it is downside of the mother, that's why it's not every pregnancy that you go to do vaginal examination. Because if the placenta is lying low and you put your hand there, you may trigger a bag of, just like a balloon fill up with a punch it. Blood will fill everywhere. You can kill the woman. So in that case, it's a contraindication. But to know how far the placenta,
it has to be after birth.
Yeah, it has to be
so you need to make sure that this is happening in a place where the people are well equipped for emergencies.
Prepared for emergency and all that. That's why we're actually running on it will have a blood bank system that anyone can call upon any time of the day to be in position to have a backup. It's not because sometimes in a city you find out that
messages or WhatsApp posts, send them to 07